welcome to our webinar on living systematic reviews. I am absolutely delighted to introduce our presenter, Dr. Rebecca Hodder. So Rebecca and I have not only worked together for many years, but as a fun fact, we've also known each other since our days in the primary school band, and what fun times they were, Rebecca. So aside from primary school band experience, Rebecca brings a wealth of expertise to today's session. So Rebecca is an NH&MRC Research Fellow, Cochrane Public Health Research Associate, and a Program Manager within Hunter New England Population Health. And of course, we're lucky to have her as one of our research leads within the National Centre of Implementation Science. So Rebecca is an international leader in the generation of living evidence. She has extensive experience in evidence synthesis, and over the past 17 years has dedicated herself to applying and producing evidence to inform the implementation and evaluation of chronic disease prevention and wellbeing programs. So we're very fortunate to have her guide us through today's webinar. But before I hand over to Rebecca, I just wanted to flag that we will be having dedicated time for Q&A later on in the session, but we'll also be monitoring the chat, so feel free to pop any questions that might bubble up while she's talking in there. Otherwise, as I mentioned, we'll open up the floor for questions after Rebecca has finished her presentation. Now, just to let you know, I'll be driving the presentation and Beck will be talking because, yeah, we're just having a little bit of internet connection, so bear with us. I'm sure you will experience similar issues, so we'll do our best, but that's all from me. So over to you, Rebecca, when you're ready, but I will just bring up your presentation with you.
Wonderful. Oh, well, I might just kick off anyway, as that's coming up. Thank you so much, Meg, for such a lovely introduction. And yes, it has been a delightful long history between you and I. And yeah, so pleased to be presenting today this webinar on living systematic reviews, the what, the why, the when, and the how, on behalf of the National Centre of Implementation Science, Cochrane Public Health, University of Newcastle, and also Hunter Medical Research Program, Population Health Research Program. So before I begin, I would like to acknowledge the traditional custodians of the land that I'm presenting on today as well, and that's the Awabakal people. And I'd like to pay my respect to elders past, present and emerging, and also extend my respect to any Aboriginal and Torres Strait Islander people that are joining the webinar today. So as Meg mentioned, we do have some slow internet at my end, so hopefully clicking with Meg driving the presentation, we won't run into too many problems, but apologies if there's some transition issues as we go. So next slide, please, Meg.
Okay. Oops, sorry, people.
Wonderful. So in terms of a brief overview, what I'm going to cover in the webinar today is a brief background to the why living systematic reviews came about. I'm going to describe what a living systematic review is and how it is different to the other types of systematic reviews or reviews that people do, when you should consider conducting a living systematic review, how to do a living systematic review and what's involved, and then what I'm going to do is describe a detailed case study on how we converted one of our existing systematic reviews to a living systematic review and what we achieved. And then finally, I'd like to share some of what we've actually learned while conducting living systematic reviews. I'll highlight some of the key resources for those people that are embarking on a living systematic review. And finally, I'll just share some other resources and links where you can go for more information. Next slide. So first, just some of the background. So I think we all probably know systematic reviews are considered the highest level of evidence to inform evidence-based decision making. And, you know, as such, policymakers, clinicians and practitioners worldwide rely on high-quality systematic reviews to inform the selection and also the delivery of healthcare to improve population health. But to be useful, they need to be relevant. They need to meet their intended purpose. And so reviews need to be valid, they need to be reliable, they need to employ high-quality methods, and they also need to include the most up-to-date research, so the most recently published research studies. However, what actually happens in reality, though, and in practice, while we've been able to very reliably produce valid reviews that employ high quality methods, continually maintaining the currency of those systematic reviews has proven to be a much greater challenge. And so typically what happens with reviews, they take years to produce and even longer to publish, and they're infrequently updated. So even Cochrane reviews, Cochrane reviews are large gold standard best practice reviews, they frequently take up to 12 months to complete. And they're typically published with studies from about 12 months ago, but they're also infrequently updated. And so in particular topic areas where research is being rapidly produced, this means that the reviews can actually be out of date when they're actually published. And considering updates are only conducted every couple of years at best, it could actually be years before the next update of a systematic review and evidence synthesis is published. And what that does is really limit the usefulness of published reviews. And it's this exact challenge that spurred the development of living systematic reviews as a new approach to continuously identifying and synthesising new evidence as soon as it becomes available to solve this issue where we want to retain currency, high methodological quality, and the usefulness of systematic reviews in high-moving topic areas. So what is a living systematic review? You can see the definitions on the screen. So it's been defined as a systematic review that is continually updated, incorporating relevant new evidence as it becomes available. So in practice, this means continual surveillance for new research evidence through ongoing or frequent searches and the inclusion of any new relevant information into the review in a timely manner so that the findings of the systematic review remain current. So how is a living systematic review different to other systematic reviews? So you can see on the screen a table that compares living systematic reviews to a frequently updated review, a rapid review, or a standard review. And so you can see that compared to the other types of review, an LSR has explicit predefined methods describing search frequency. They also have explicit predefined methods when describing when new evidence will be incorporated into the review, and also continual evidence surveillance. And new evidence is immediately flagged for a reader or incorporated into the review. So they're the main differences between existing reviews. The other thing that's really important is that last point there. So living systematic reviews still adopt standard systematic review methods. So the same processes in terms of screening, data extraction, and risk of bias, for example. A bit more information. So a living systematic review can actually be applied to any review type. It could be intervention reviews. It could only include randomised controlled trials. It could apply to qualitative research questions and more recently cost effectiveness analyses and other types of research questions. It can be applied to new reviews. So from inception, or existing reviews can actually be converted to a living systematic review. The idea is that they retain all core systematic review methods, but there are additional living systematic review specific methods that are pre-specified at the protocol stage that are adopted during the living phase. It also has frequent continual evidence surveillance, which and updating is explicit, and it's stated a priori. So it's much more frequent than other types of reviews. And a living systematic review typically starts with a standard baseline review from which you then commence your living processes and continual evidence surveillance. And I'll go into some of these steps in much more detail later on in the presentation. The criteria is like excellent. So whilst I mentioned earlier that living systematic review methods can be applied to any type of review, not all systematic review questions are actually appropriate for an LSR. And there's some really key criteria that we need to consider. So first, is the systematic review question a priority for decision making? Second, is the certainty in the evidence to date that's been synthesised low or very low? So that is, it's uncertain. Third, is there likely to be new research evidence produced which could be identified and synthesised in a living systematic review? And not an official criteria, but from a pragmatic perspective, which is really important, we need to also know that you've got the author capacity, the editorial capacity, the project management skills, the systematic review skills within your team or within your proposed team to be able to feasibly implement a living systematic review. And I'll drill into each of these in a bit more detail later in the webinar. However, generally speaking, if all of the answers to these three criteria plus this extra fourth one are met, then it could be a suitable review or review question to convert into living mode. Excellent. So on the screen, you can see the basic workflow of how a living systematic review is conducted. So from the screening, data extraction, risk of bias, etc. So as with a standard review, you can see in the top left-hand corner, it starts with running searches of databases and other sources to identify any records that may be eligible for inclusion in the review. The records are then screened against eligibility criteria to identify included studies. If no new evidence is found, then there is nothing to be done until the next search. If new evidence is found, however, then brief data extraction is conducted and a decision is made whether to integrate the new evidence into the review immediately or integrate later. And I'll talk about this a bit more later as well. And then following that, normal data extraction, risk of bias, synthesis and analysis processes are undertaken, and the review manuscript is drafted and republished. So to make this more concrete, what I'm going to spend a little bit of time now on is describing our own living systematic review. And I'll talk about the history of the review and why we converted it to a living systematic review and how we actually went about that. And so, excellent. So in 2012, we embarked on a Cochrane systematic review to determine the effectiveness of interventions to increase the consumption of fruit and vegetables in children aged 5 years and under. And the reason that we did that was because we wanted to inform our service delivery efforts to improve the diet of children attending childcare settings in our local health district. So for this review, we wanted to identify studies that were randomised controlled trials that reported a dietary or biochemical fruit or vegetable intake outcome and included children with a mean age of 5 years or younger. And you can see on the screen a little bit of the timeline of our review. And the original review was published in 2012, which you can see included just 5 trials. And what we actually found, the conclusions of that review was that there was little evidence of effectiveness for any of the types of intervention approaches that we identified in the original review. So fast forward 5 years and we embarked on an update of the original review, which to our surprise identified a whopping 45 new eligible trials. So after that, we conducted data extraction, risk of bias analysis, and we published the first update, which included 50 trials in total in 2017. So following the publication of that review in 2017, we came into contact with some researchers from Cochrane's Project Transform group. And so for those who haven't heard of Project Transform, it was a really large Cochrane project funded between 2015 and 2018, which was intended to improve the way people, processes and technologies can come together to produce Cochrane systematic reviews. And that included the concept of living systematic reviews. And at the end of the presentation, I've actually got some links to, if you want to have a look and find out some more information about that group. So in 2018, we were actually invited to become involved in that project as one of the pilot studies. And specifically, the aim was to test the feasibility of converting and maintaining our review as a living systematic review over a 12-month period. And within that, what we wanted to do was use next generation evidence systems that the Project Transform team had developed as part of the processes to see whether they were feasible and whether they actually reduced any of the effort required in implementing living systematic reviews. So before I get into the detail of what living mode meant for our review, why did we consider our review for a living systematic review? So in reference to those 3 criteria I mentioned on the earlier screen, so we deemed the review question to be a priority for decision making. And the way we justified that was we know that there is a growing burden of disease from low fruit and vegetable consumption globally. We also know that early childhood is a critical period for the development of healthy eating behaviours, and that globally fruit and veg recommendations are not being met by children. So we definitely thought we ticked off that first criteria that it was a priority for decision making. We also knew from the 2017 review that the certainty in the evidence to date was very low for actually all of the types of interventions that had been tested to date to improve consumption of fruit and vegetables. And I think the last point, Meg, if you can click through on the screen, please. Thank you. And we also knew that from the 2017 update that there was actually likely to be a lot of new evidence coming through after we identified the 45 new studies in that review. And then we also identified another 5 ongoing studies that we knew would be published very soon as well. So it was on that basis we knew that a living systematic review was a good fit for our research question, and we got started. So next slide, thanks, Meg. So during the pilot, what we did was conducted a baseline review. And so that was to get all of the records up to date so that we knew we had everything published up to a certain date. And from that point, we then started our monthly screening processes, which again, I'll talk about in more detail. During the pilot, we were also able to publish a further 2 updates as well. And then following the end of the project, we've actually maintained it, which you can see on the screen, our review in living mode, and have now published actually 4 updates of the review. And we've actually got the 6th update, which is actually currently under review with Cochrane as well, that we submitted last year. So what methods did we adapt? What methods did we adopt even? What did we apply and what did that really look like in practice? So the first dot point you can see there. So in terms of the search methods, so from 2018, we amended our protocol and we started monthly searches of the existing databases, and we supplemented it with searches of other sources every 6 months. So the eligibility criteria for the reviews remained exactly the same. So we were still looking for RCTs, we were still looking for children aged 5 years or younger and with an outcome of fruit and veg consumption. But we did modify our study selection process as part of the trial, and that was really to embed, which at the time was very, very new, machine learning and crowdsourcing technologies. So that's RCT classifier and Cochrane Crowd. Within our workflow. And I should mention the RCT classifier at the time was only actually, has frequently only been available to Cochrane reviews, but that's actually now available within Covidence for other reviews, but Cochrane Crowd is still limited to use within Cochrane Crowd, but I'll talk about them in a little bit more detail. So the RCT classifier is a tool that screens records from your searches to identify the likelihood of whether they're randomised controls or not. And so for our review, we had an information specialist from the Heart Group that did our searches for us. And so when our search was sent to the RCT classifier, it split our records into 2 groups. So one group was the studies that were unlikely to be randomised controlled trials, so 0 to 10% likelihood of being a randomised controlled trial, and those that were more likely, so the 10 to 100%. And then we sent those records that were unlikely to be randomised controlled trials to the Cochrane Crowd to confirm whether those records were actually randomised trials or not. And for those that don't know, so Cochrane Crowd is actually a citizen science platform that can be used to classify systematic reviews against lots of eligibility criteria. So anyone in the world can participate in the Cochrane Crowd, and there's training modules that you do to be able to be a member of Cochrane Crowd and make some classifications. And so what we were asking the Cochrane Crowd to do was check whether these trials that we didn't think were randomised controlled trials for the RCT classifier were or not. And then finally, what we actually did within our local author team was we did the title and abstract screening of the 2 sets of files. So we looked at those that the RCT classifier said were RCTs, and then we also looked at any files that came back from Cochrane Crowd that they thought could be RCTs, and it slipped through the classifier. And so finally, that last dot point there, we didn't change any of our processes in terms of analysis, risk of bias, or our grade assessments to assess the certainty of the evidence. So you can see on the screen here a more detailed living systematic review workflow that we use for our LSR. So following our monthly searches and our tech-enabled screeners, you can see if new studies were found, then we conducted data extraction processes, immediately incorporated the new studies. Whether we found new studies or not, via the Cochrane updating classification system, we actually each month let people know when the last search was conducted and also how many new studies we had identified that would be included in the next update of the review. And then during the pilot phase, with considerable support from the Cochrane Heart Group, we also aim to update and republish our review every 4 months. And as I mentioned before, the explicit aims of the pilot were to test the feasibility of this workflow, both from embedding the tech aspect of it within screening, as well as testing these shortened timelines for review, production and publication, which at the time, I think many thought we might not have been able to deliver. So in terms of results, on the next screen, thanks, Meg. Thank you. So how did we go with the screening? So what I'm going to take you through is the number of records that filtered through our screening process, how the RCT classifier was applied, how it split the records, and then what we ended up doing and what sort of savings we kind of found in terms of the author resource or contribution to the screening process. So I'll say from the outset that we were definitely able to successfully integrate the machine learning and RCT via the RCT classifier and citizen science via Cochrane Crowd into our screening, and it did definitely reduce the amount of time that authors needed to do screening. So you can see, oh, excellent, sorry. Now I'm a bit slow, Meg, thanks. So you can see there, so what I'm going to take you through, sorry, is the data for the first 8 months of when we were in living mode during the pilot. So you can see on the top left-hand side, we got just over 1,600 records that came through in our first database search after deduplication. And then on top of that, we found another 935 records from other sources. We then applied the RCT classifier to identify which of those records were likely to be randomised controlled trials or not. And there was just over 2,500 that went through the RCT classifier. So just over 1,200 records were assessed as likely to be randomised controlled trials and went through to the author team. And 1,300 approximately records were less likely to be randomised controlled trials. So you can kind of see that the combination of the RCT classifier and Cochrane Crowd more than halved the records that the local author team was required to screen. And I guess the other point I'd make in terms of efficiency of the Cochrane Crowd, when we sent our batch of records to them, they're actually able to complete the screening of those records within 5 hours. So it was very, very efficient. At least at that time for us, it was amazing. And so in terms of the review production and the proposed dissemination timelines, we were actually able to successfully publish our review updates every 4 months using those processes, but not without considerable support, as I mentioned before, from the Cochrane Heart editorial team. So they were involved in developing a new and accelerated publishing workflow, like editorial workflow, in collaboration with us and also the project Transform team. So you can see up there on the screen where we got to, and that we're still maintaining that review as a living systematic review. So since completing the pilot though, we've actually tweaked our methods a little bit. So what we've found over time is the monthly yield of the records that we actually come through for our review have often actually been only 40 records. And so what we've actually done is reverted to conducting title and abstract screening within our author team without any of the use of tech enablers, as the time savings for adopting those were actually negligible. And in terms of the republication of the review, so in line with the current living systematic review guidance, we actually now consider whether incorporation of any of the new studies that we identified actually change the conclusions of the review before we embark on producing and publishing a new review update. Thanks, Meg. And so briefly, just to demonstrate what evidence that we've found over time for our living systematic review and for interventions to increase fruit and vegetables consumption. So what you can see up on the screen are the 4 main types of interventions that we've identified that have been trialled to improve fruit and vegetable consumption. And the results on the screen are up to the last published version of the review in 2020. So you can see the first, in the first quadrant, there's child feeding interventions. So they're interventions like repeated exposure to vegetables. And we've seen a big increase in those studies over time. And in the last published review, we actually had 50 studies that were included. I think, Meg, sorry, I've got some pop-ups that come up over these graphs, and I've got the actual results. And so what we found with child feeding interventions, there is a small positive effect of these interventions, but low certainty evidence. On the right-hand quadrant, you can see the multi-component interventions are the next most frequently implemented. Similarly, and we've got moderate evidence so far that these types of interventions produce a small positive effect on fruit and veg consumption. Down on the left-hand side, we've got parent nutrition education interventions that were up to 15 included studies, and we have low certainty evidence of an uncertain effect. And then for child nutrition, we've actually only got 2 studies so far that have been implemented that we've identified. So what have we achieved? So to date, we've actually screened over 40,000 records since we started this process in 2017. We've actually produced the first ever Cochrane systematic review that was successfully converted to be a living systematic review, which was a really exciting achievement. We've also been able to demonstrate that it's feasible and to produce and publish a review every four months. And we have been able to maintain the review as a living systematic review since 2018. And overall, I think the other comment I would make is that we've found it highly feasible and a really successful approach to maintaining the current evidence base for our research question. And excitingly, what's also happened is this work has actually been informed the development of guidelines for the production of living systematic reviews internationally, and also living evidence reviews and models more broadly as well. Thanks, Meg. And so for this next section of the webinar, what I'm hoping to do is focus on some of the more kind of practical aspects of conducting a living systematic review, and what our team and what others have actually found to be the key enablers of successfully establishing and maintaining a living systematic review. So some of the things really important to consider from the planning stage, if you're thinking on embarking on a living systematic review, you need to make sure and identify that you have got a journal and an editorial team that is willing to come on this journey with you, or already have workflows set up to enable the production of living systematic reviews. So as part of the pilot, there was really large shifts in the way Cochrane reviews were managed in terms of editorial and peer review processes to allow us to be able to demonstrate a living systematic review is possible. And obviously Cochrane's got those in place, but there's lots of other journals now that are also adopting or publishing living systematic reviews, and have similarly changed their workflows to accommodate them. But yes, getting in touch with journals and making sure that they're happy to take your living systematic review before you start is an excellent idea. The second one there is about partnering with information specialists for searches and automation. So often within Cochrane reviews, we have information specialists that are available to support us with searching, so we don't have to handle that within the review team. And we certainly did as part of our pilot for this living systematic review. But since then, we don't have that support as much anymore. And now what we're actually moving to is automation of our database searches so that they are all automated and they come to us. But definitely good to have an information specialist as part of your team before you embark. The other really important thing is making sure that you have sufficient author capacity and motivation over the time you plan to keep your review living. That's to complete the monthly tasks, so complete the monthly searching and management of files and identification of new studies via the screening. And also, later on when you get into the point of doing all the data extraction, the quality appraisals, the synthesis, and actually drafting the manuscript as well. And I think at various times through this review, we've had authors that have committed to, maybe a 12-month stint of being part of the review, and then we review that quite regularly and see where people are at to make sure that we've got a team of authors with the right expertise and the capacity available ahead of time. So when we're ready to flip the switch and go to a production mode and publish a new version of the review, that they're there ready to jump in. Some of the other ones, which are probably very straightforward, but there's lots of living systematic review resources and support, and also available for everybody to use. And I've got a slide later on that I'll demonstrate or show some of those in more detail. The other thing is looking to see what sort of tech enablers are available, or other tools that can help reduce the amount of time that authors need to spend on living systematic reviews, is also a very good idea to do as early as possible in your planning process. And again, I'll come back to that in a bit more detail later on in the presentation in the webinar. In terms of project management and sustaining a living systematic review over time, as with any review, I think you need to plan and identify the author's tasks and timelines early, but also ensure you've got really strong project management within your team as well to tightly manage tasks to timelines. So often what we do is map out for that year exactly who's doing what, make sure people have the capacity, put in the timelines for when we think things are going to hit. We're ready for people to jump in and support us with the next stage of the review. But yes, very important with a living systematic review. The second point I've got there is making sure that you've got really good processes and systems in place for monitoring new records and new studies, associated studies, ongoing studies, etc., and how to group those studies and deduplicate against previous searches. In supporting people to do systematic reviews for the first time, going through some of that, data management process when you're trying to understand what records are coming in, what records are going out, how they relate to your PRISMA statement, can be, it can be challenging to get your head around for the first time. But for a living systematic review, it's actually even more important that you have those records in place and those systems in place right from the outset to be able to monitor those over time and track any records as they come through various iterations of the review, and possibly change classifications as well. So that's critical, really important. The third point there is around a flexible authorship model, which is a little bit different to systematic reviews or other types of papers as well, where, as I flagged earlier, we might have authors that commit to contributing for a period of time or for a number of updates. And so what that means as well in terms of authorship is that, we might have a team of 15 authors, for example, that are listed as co-authors on various iterations of updates, but not necessarily all of them if they haven't contributed to some of those in between. And finally, identification of sufficient ongoing funding to support and sustain the implementation of your living systematic review is important. During the pilot phase, we had some funding allocated, and since then we've had limited funding to progress our review. But I think the success of our living systematic review in particular has really relied on a really great team of postdoctoral researchers, early career researchers that already have some systematic review experience and had capacity to contribute their time in kind for this review. So I think that's really, that's been critical to the success of our review, but also I think most recently, limited author time in terms of our monthly searching has actually been, quite feasible and approach for us to maintain it. So in terms of what others learnt, I will just go through one study that's been conducted, but there's one seminal study, I should say, but there's also many others that have been conducted since. So on the screen, you can just see a summary of a mixed methods evaluation that Tanya and Millard published in 2019, which was aiming to assess the feasibility and acceptability of the living systematic reviews that we were piloting. And really the purpose was to refine the future living systematic review projection models. So you can see on the screen there were 6 pilot living systematic reviews, and there was a range of participants involved in the mixed methods evaluation. And you can see that the participants highlighted lots of things like the importance of a motivated, efficient team to manage the monthly requirements of a living systematic review, the value of the machine learning and the citizen science approaches to screening and to managing the workflow and reducing time commitment, and the ongoing and continuous commitment required of a living systematic review. And then finally, the significant potential really for the time and the effort savings in the long run of doing a living systematic review using these models. But overall, I think they found it to be acceptable and feasible approach, which is certainly very consistent with what we've found as well. So what's next for our living systematic review? So the idea of living systematic reviews is not that they remain living systematic reviews until the end of time. So, you know, this approach, we obviously think this is an approach that is feasible for us to keep going with, and we continue to maintain it as a living systematic review. And the reason that we're doing that against those 3 criteria I mentioned earlier is that we know that this topic remains a priority for decision makers internationally. We also know that for some of the intervention approaches, based on the last review we published, that the evidence is still very low to low certainty. So that means that the inclusion of new studies in the future could change some of the results and change some of the conclusions of the review. And the final point there, in the last review, we actually identified 19 ongoing trials in the last update, and we've since identified another 15 studies that were considered for the current update of the review that's under peer review at the moment. And so broadly as well, this adapted model where we have been monitoring or have been doing all the surveillance and the screening within our author team continues to be feasible and successful. And so what we're doing is we're continuing our monthly searches. We continue to review the methods periodically as well, just to see if there's any movement in efficiency or any other new recommendations for how living systematic reviews should be conducted. And then we're continuing to review this living systematic review criteria as well, just to make sure it still meets the requirements for a living review. So this next slide, I just wanted to highlight 4 key resources for anybody that is taking on a living systematic review. So first on the screen you can see is the revised guidance for conducting living systematic reviews that was published in 2019. This guide is excellent. It provides really detailed and practical guidance on all the aspects of conducting a review, from planning and protocol development all the way through to publishing. So it includes guidance on developing your protocol, working with editorial teams to publish, when to go into living mode, when to update a living systematic review, and periodical review of the appropriateness of the methods in the author team that I mentioned before, but also importantly, like when to transition out of a living mode and kind of retiring the living systematic review methods of your review. The second, on the screen there as well is there was a 4-part series that was published on living systematic reviews in the Journal of Clinical Epidemiology in 2017. And so you can see the topics that are listed there on the screen. I highly recommend people having a look at those. I think some of the methods, the statistical methods and the living guideline recommendations have been advanced since those publications, but these were the kind of 4 seminal publications on living systematic reviews. And the third one there is the Cochrane Community Living Systematic Review website. And so that's got links to the living systematic review guidelines, there's webinars and lots of other living systematic review resources listed on there as well. And the final one on there as well is the living systematic review, the Living Evidence Network. And so this is an informal network that you can join, which brings together those involved in the first Cochrane Living Systematic Review pilots, but also people, you know, all across the world that are interested in living evidence. So this next slide is a very brief look at all of the tech enablers, or some of the tech enablers, I should say, that have been developed to date for living systematic review productions. And so I think this actual table comes from a scoping review that was published in 2022. And at that time, they identified 47 publications that describe the reliability and validity of various tools that have been developed to support the automation of systematic reviews. And they can be used across like various stages of evidence synthesis as well. And they're tools that can be applied to either Cochrane reviews or non-Cochrane reviews. I think the important thing to note here is that, you know, some of these technology enablers are further developed and validated than others. So it's really a good idea when you're considering adopting any of these tools to look into the evaluation literature and understand the strengths and limitations of those before you adopt them, and also whether they're appropriate for your review question. So this list is definitely not exhaustive, and there's many other tools that have actually been developed since this review synthesised these. And some of them, you know, they are only available for Cochrane reviews. So there's a Screen for Me program, for example, which embeds the RCT classifier and the Cochrane crowd into one tool. but many others and most others are actually available for Cochrane or non-Cochrane reviews. So this is just a quick example, and I think we might mention another webinar that will be running on these in more detail in the future. So my take-home messages as I kind of wrap up. So most importantly, not all review questions are or continue to be suitable for a living systematic review approach. It's not the intent that reviews remain in living mode indefinitely, and we really need to make sure that we're reviewing against the criteria regularly, even if they have been converted. So is the review question still a priority for decision makers? Is the certainty in the evidence still low or very low? Is there still likely to be new research evidence coming through? And do you have sufficient resource and capacity to continue in living mode? The other thing that I'd like to make a very strong point for is that we know that living systematic reviews are a feasible and successful approach for surveilling and also the rapid synthesis of up-to-date research evidence so that we can maintain the currency of systematic reviews to inform policy and practice. I think the evidence for the success of living evidence and living systematic reviews is really demonstrated as well by their broad and wide-scale adoption in a relatively short period of time. And so this is both by researchers, but also international health policy agencies as well. So since the first 2 living systematic reviews were published in the Cochrane Library in 2017, there's now more than 150 living systematic reviews that have been published in dozens of peer-reviewed journals. So that spans the Lancet, BMJ, Nature, and many other healthcare and public health focused journals. And I think the other aspect is, living systematic reviews have enabled the innovation of living evidence more broadly and specifically for living guidelines, which have been adopted by the UK's National Institute for Healthcare Excellence, the World Health Organization, and many other guideline and policy organisations to make sure that the healthcare, the policy and practice decisions that are being made are based on the most up-to-date evidence. And this is a massive shift, especially in how clinical guidelines are produced, where there's been even greater lags in terms of the production of the evidence and clinical guidelines often. So I think up on the screen, you can see, just click through to the next bit. Thanks. So some of the most recent examples of guidelines, including living systematic reviews, are those that have been focused on COVID-19. So the COVID-19 living guidelines in Australia were evidence-based guidelines for clinical care of people with COVID. And so they actually, as part of the living systematic reviews underneath that, were conducting continuous evidence surveillance and rapid synthesis on a weekly basis to be able to provide the most current information and recommendations for COVID care. So it's an excellent example. And, it's up. So finally, I'd like to just end on this slide. So Professor Tari Turner, who I don't know who knows her or not, or who has the privilege to know her or not, she continues to be such an amazing international leader in living evidence. And she has said this many times about living systematic reviews. They are not rocket science. They're using existing systematic review expertise and methods. And I think, it's probably how we should always have been doing systematic reviews on priority research topics. And I think, with all the new, better, faster tech enablers, machine-assisted tools and AI processes for systematic reviews that are being developed internationally, and the exciting new research agenda that's being led locally on how living evidence can integrate with policy decisions, we're only really beginning to realise the potential that living systematic reviews have for reducing research to translation pathways, but ensuring that healthcare and health policy and practice decisions are based on the best available evidence. So I think it's a bit of a watch this space to see where it can go to, but it's certainly a very exciting space to be in, and I'm delighted to have had the opportunity to talk to everybody about it today. So on the next slide, Meg, we've just got some references and some other resources if people want to have a look at them. And then on the final slide, I'd also like to make some acknowledgements. So you can see there in the first dot point, the lovely, large and wonderful team of co-authors that have supported our living systematic review on fruit and vegetable consumption, and also the Cochrane Heart Group and the members of Project Transform. Thank you very much for attending today, and also I love living evidence, so I'm looking forward to hearing from people. So please reach out if you want to talk living evidence with me. Thanks very much.
Thank you so much, Beck. That was amazing. And yeah, I've obviously been aware of your work, but it's been wonderful just to be stepped through it in that really exciting and accessible way. So we're here for questions. We've got time for questions. And while everybody's digesting that, I can see that we've already had one come through in the chat from Amy. So you did kind of briefly touch on this, Beck, but Amy's asking about the costs associated with, I guess, producing living systematic reviews. She said that publishing in some journals costs thousands and thousands of dollars. So how does that actually work for living systematic reviews?
Well, I think in terms of the cost of the publication, that's really with the journal that you select, unfortunately. So where it's kind of relevant for your review to be published. So yes, there definitely is a cost if you go into one of those journals. In terms of the cost of actually producing a living systematic review itself, I'm not sure that we've actually done it to a definitive degree to put a monetary value on it. I guess I can talk to what the model looks like for us at the moment. So myself and the wonderful Kate O'Brien, who has been involved with our living systematic review since inception with me, are really the only people that are continually working on our living systematic review. So we do the title and abstract screening and the full text screening, and Kate does the data record management behind the scene. So I would estimate we probably spend about, I would probably only spend about 6 hours a month during that kind of screening process. Kate would spend a little bit more. Really the resource requirements come into more when you are ready to republish your review. Because obviously that's when you need to make sure that all of the full data extraction is conducted, all the quality assessments conducted, the manuscript itself is drafted, and so that could take a couple of weeks of full-time kind of work for myself, Kate, and for other members of the team to be able to produce.
Thanks, Beck. Okay. Any other, how much author support do you need to maintain a living systematic review? Lucy.
Yeah, sure. So I think on top of, I guess, what I just mentioned then, I think over time we've probably had about 16 authors that have been involved in various iterations. Most of the time with each update, I think we've had probably a maximum, or most recently we've probably had a maximum about 5 or 6 authors that have contributed. And I guess the way that we manage that is that we may have 2 of our authors that are dedicated to doing the data extraction, 2 are doing risk of bias, but then Kate and I will predominantly lead the majority of the work, kind of similar to the hours that I mentioned before.
Brilliant, thank you. Thanks, Sam. How do you decide when to republish a living systematic review?
Excellent. Thanks, Sam. Great question. So as part of the pilot, we didn't really consider that question because we were trying to push the boundaries to see how quickly we could publish. And that's when we were able to publish every 4 months. Outside of that process, the guidelines currently actually are more around, well, what does it mean? What do your results currently mean when you've included those new studies? So if you include the new studies that you've got in so far, does it actually change the conclusions of the review? So there could be a couple of different ways that the conclusions could be changed. It could be that you've got new studies in there that trial some different types of intervention approaches that you haven't synthesized before. So that might be enough to trigger republication of the review. The other one might be that the quality or the certainty in the evidence. So by your grade assessments, it might have gone from very low certainty evidence up to moderate quality evidence. And so that change in the quality of the evidence could also trigger a republication of the review because it would change your certainty in the conclusions that you're able to draw. So any of those things, or even actually the change in the effect estimate as well. So if we're seeing like a big increase or decrease in the effect estimate that within the author group we discuss and think is sufficient to warrant republication, then that would also trigger a republication.
Awesome. Thanks, Beck. Another question from Belinda. You mentioned the 4-month time period for publishing. Is this dependent on the policy environment or other factors?
Great question. So it was just during the pilot that we were kind of pushing those boundaries to see how quickly we could republish. And I think, you know, it could possibly be a bit of both. I think outside of that pilot, though, we really want to make sure that the conclusions are changing if you're going to republish. I think that doesn't stop, you know, synthesis without republication in between any of those points as well. So there might be that there is like a policy need or other need that might trigger a request, or, you know, working in collaboration with others to be able to produce up-to-date evidence. So it could be based on policy, but generally speaking, you know, as per the living review guidelines, it would be around if the conclusions or the recommendations of the review have changed.
Brilliant, thank you. Is there anyone who wants to jump in and ask a question live? All right, well, it looks like we are good. So I want to just flag, as Beck had mentioned, that there is another session coming up. Hopefully you can see that. The details will be released via our website, on X and on LinkedIn, and I'm sure we'll be able to also send them out to all the members of this webinar. As we will do with all the resources and links, we'll make sure people get those. So that will be very exciting, and I'm sure it'll be of great interest to many of you who are part of today's webinar. But other than that, I just wanted to say a giant thank you to everybody for joining us, and a massive thanks to Rebecca and to her team for contributing to this session today, and for bearing with our tech issues. We really appreciate it, and look forward to seeing everybody again soon. So thanks so much.